Good morning, all. Today's topic is smoking cessation in general dental practice. These are the learning outcomes. Come to introduction. Smoking remains the largest single preventable cause of death and disability in Malaysia. Many people die prematurely due to smoking related disease worldwide. Smoking is the single most important public health problem. The detrimental effects of smoking and tobacco use on oral health are well recognized. Then, what is addiction? Addiction is defined as not having control over doing, taking, or using something to the point where it could be harmful. Addiction is most commonly associated with gambling, drugs, alcohol, and smoking. What causes addiction? There are lots of reasons why addictions begin. In the case of drugs, alcohol, and nicotine, these substances affect the way it feels, both physically and mentally. These feelings can be enjoyable and create a powerful urge to use the substances again. How addiction can affect? An addiction can have serious psychological and physical effects. Some studies suggested a person's risk of becoming addicted is partially genetic, but environmental factors such as being around other people with addictions are also thought to increase the risk. Unemployment and poverty can trigger the addiction along with stress and emotional or professional pressure. Okay, what is the potential reason for quitting smoking? By quitting smoking reduces the risk of halitosis, improve appearance, that is less staining on teeth, better skin texture, and it will save money, feel better and more energetic, break dependence on tobacco, reduced risk of cancer and heart disease, better periodontal health, reduced risk of oral cancer, and improved success with surgical treatment. Why is behavioral change is so hard? Most of our behavior is habitual. Behaviors become automatic when repeated over time. Successful behavioral change is hard because our brains get stuck in fixed patterns. The role of neuroplasticity in behavioral change. Neuroplasticity is the process by which our brains change as we learn. It refers to the physical structures of the brain. A new connection forms in your brain every time you learn something new. It's weak at first, but with repetition, that connection becomes stronger over time. This makes the new, healthier behavior into a habit. The three stages of neuroplastic change process are: first is a chemical, second is structural, third is functional change. Coming to the chemical change, these are short term changes in brain chemistry in response to a new behavior. They boost short term memory and improve motor skills short termly. Then comes to second one, the structural change. In new connections form, altering the brain structure, this boosts long-term memory and long-term improvement of motor skills. In the chemical change, it is short-term memory. In the structural change, it's long-term. Coming to the functional change, entire brain networks change, becoming more efficient in their functioning. This is when lasting behavioral change occurs. Intentional behavioral change requires weakening a strong neural connection to break the old habit. At the same time, you strengthen the new one. This is hard because setbacks can easily knock us back into our old mental patterns and behaviors. These are the three things, three changes, that is chemical, structural, and functional change. Then contemplation, then preparation, then action, then maintenance and relapse. Pre-contemplation stage. At this stage, people are not yet aware of the negative behavior they need to change. They don't see their behavior as a problem and are not interested in getting help. They may become defensive if someone pressurizes them to change. They also avoid speaking, reading, or thinking about it. They may also observe information about this problem from family, friends, or the media, but won't take any actions until they see it has a problematic issues. Contemplation stage. At this stage, people are aware of negative consequences or problems, but they are not yet ready to change their unhealthy behavior. They do start thinking about it, however, they know it's necessary to change but are not ready. This stage can last a few days or an entire lifetime, depending on the individual. Coming to the next stage, that is preparation of determination stage, preparation or determination stage. This is the phase when person is ready to make a change. They become committed to change and motivated to take the necessary steps. They read, they talk, and gather information about the problem. The preparation stage is crucial to the success of behavioral change. Skipping this stage can drastically decrease your chances of success. Coming to the next stage, that is action stage. At this stage, people use strategies they learned in previous phase to start a new healthy behavior. This takes willpower and there is a risk of failure and slipping back into old behavior and habits. It can help to avoid external temptation and set rewards for achieving intermediate goals. The support of others is also essential at this stage. Coming to maintenance stage, that's the next stage. In this stage, people have made progress and realized the benefits of change. They understand that maintaining change will require effort, but they are aware of its value. They create strategies to prevent relapse until the new habit becomes familiar and natural. This stage is when people slip back into their old behaviors and habits. Relapsing is normal part of the process of change. The key is to identify the trigger that caused the failure and look for new and better strategies for dealing with it. Bearing in mind the benefits of change helps regain motivation when restarting the stages of change model. So how to change behavior? First and foremost is physical activity, then proper sleeping, then nutrition, then medication. Time for action. Based on systematic review of scientific evidence, a smoking cessation protocol has been published and updated to encourage healthy professionals, including dentists, to become more actively involved in smoking prevention. The 5A models is straightforward and quick means of identifying smokers who want to stop and how best to help them achieve their goal. Questioning techniques and style. Use both closed and open ended questions as appropriate depending on what information you require. Give patients time to answer your questions, don't rush them. Encourage patients to speak openly and honestly. Take care not to be seen as nagging or judgmental. This achieves nothing. Sum up any information given to you to check you have understood what has been said. This is the progesterone test for nicotine dependency. This is a scale which measures the dependency of nicotine and corresponding dependency score, and it's like how to treat at the dependence level. The 5A models for smoking cessation includes the following steps. First is ask. Identify and document tobacco use status for every patient at every visit. Advice. In clear, strong and personalized manner, urge every tobacco user to quit. Assess. Assess the patient willingness to make a quit attempt. Provide aid to patient in quitting, that is called assisting or assist. Then arrange schedule follow-up contact with patient to provide additional support. So these are the 5 A's: ask, advise, assess, assist and arrange. Coming to 5R. 5R we have to use when the patient is not able to quit or relapse. During that time, we can go for this 5Rs, that is relevance, risk, rewards, roadblock and repetition. In relevance, encourage the patient to indicate why quitting is personally relevant. Risk, ask the patient to identify potential negative consequences of tobacco use. Rewards, ask the patient to identify potential benefits of stopping tobacco use. Roadblock, identify, anticipate potential roadblocks you may encounter during your quit journey. Repetition, reinforce the idea of repetition so you are prepared to recommit to your quit even if get off track.